Here we are, Tracy, doing another episode of the Wellness Duo. And this time we are going to be talking about menopause, which is a hot topic at the moment, I feel. There's a lot of conversation about menopause, perimenopause, and the symptoms associated with that all over social media. I think there's a lot of greatness coming out of that because we are now finally talking about it, balancing that with being overwhelming for people and maybe too much stuff is being hammered at women about menopause. So I am actually very mindful of that and how we can actually help women as opposed to sell to women. Tracy, you're a naturopath who does work a lot in this area. Can you just start off by giving maybe the listeners a little bit of a rundown on your background when it comes to women's health around
Yeah,
menopause?
sure. Yeah, I've always had a keen interest in women's health. So I've focused on that all through my career. And I focus primarily on the gut microbiome, hormones, and nervous system. And of course, being a naturopath, you treat holistically. You're looking at all body systems, but they're my keen interests and looking at how they all interrelate. And we can talk about that today around menopause.
We are now knowing that there's something like 75 or more symptoms that can be associated with menopause. And I think in the past, particularly things around mental health, panic, anxiety, depression, that sort of stuff might be piled into a different category and not necessarily linked back to perimenopause and menopause. We're just understanding a little bit more around what symptoms are possibly triggered by having fluctuation changes in hormone levels. What are the main complaints that you're seeing women come to you with when it comes to menopause?
I reckon the one that stands out the most is the brain fog. I think it really gets women down. It almost feels like we're going crazy because we don't know why we've walked into a certain room or we stop mid-sentence and can't remember what we were talking about. And you start to really question your sanity. So I think that is one of the symptoms that people are quite distressed about. And then, of course, yeah, the hot flushes can be really problematic, particularly around the sleep, because if you're not getting good sleep, that just makes everything exacerbated. It makes you crankier and you're already dealing with mood changes and also the vaginal dryness. So they're probably the biggest ones that I would see.
And we know that symptoms now can start quite early before menopause, maybe even up to 10 years before you actually go through menopause or you have your last periods. That's, I think, quite interesting, trying to identify what's really going on.
Mm.
And with that, obviously, would come those changes in periods and period patterns, maybe heaviness, not having a regular pattern sometimes. And I think all of that probably comes into making diagnosis a little bit tricky as well. Do you get many people talking to you about
Yeah.
that sort of stuff?
Yeah. So I think what is happening is if it's not truly early menopause, that perimenopausal period, what's happening is often people are having major stress in their life, causing dysregulation in the hormones, and it impacts the periods. And yeah, it is hard to tell whether it is truly perimenopausal, but what I see clinically in my practice is those women in their early 40s that their cycle starts to change is really easily balanced back into a really healthy cycle again when we just give the body the right support. And naturopathically, I'd be looking at stress. How is that impacting the hormones? Because the cortisol are made from the same starting compound, which is cholesterol. And cholesterol will feed down into the cortisol. And because survival is the most important thing, it over reproducing, that those hormones will always take up that cortisol, and the progesterone in particular tends to get the hardest knock. So is that making sense? Like when we're prioritizing survival over reproduction, because we
Okay.
need to survive before we can reproduce. So survival is imperative. And so what happens is we'll always be making the cortisol and the adrenaline over your reproductive hormones, testosterone, estrogen, progesterone. So we
Mm.
start to see a decline in those. And we know that stress is rampant in our life. We just have such busy lifestyles. And so our reproductive system will start to show the imbalances, the side effects of that stress.
So that was interesting. You said cholesterol is the starting point for the starting compound that's used to create. I didn't know that. So is there a link there to when they say as people are going through menopause that they might actually show they have higher lipid profiles, so higher cholesterol levels that might start to tilt up?
Yeah.
Is that because of that?
I think that is one of the reasons. It's not the only reason. I don't think there's ever just like one pathway. Everything's always interacting and like a network of things happening. So when estrogen declines, it does impact the liver metabolism.
Mm.
So it impacts the clearance of hormones.
Yes, okay.
It impacts the gut microbiome, which then impacts everything.
Yeah,
So
yeah, of course.
yeah, so yes, that is one of the reasons I think is the body will naturally start to produce more cholesterol. We produce our own cholesterol because it is so vital to life. And as the hormones decline, the body may start to produce more cholesterol to make those estrogen and progesterone or stress hormones.
Yeah.
And then, of course, the decline in estrogen impacts the liver as well. It
Mm.
makes it more prone to a fatty liver.
When you come to treating somebody, is that one of the starting points is looking at the liver? Or do you generally just look at their symptoms and trying to help manage symptoms? Or what sort of angle are you coming from? Because there's so many different ways that you could obviously come at
Yeah,
this.
yeah, exactly. So that is the trick really is to be taking a really thorough patient history so we know what's going on with their signs and symptoms. We piece that together with some pathology, blood pathology. I like to look at the liver function test. I like to look at fasting insulin, fasting glucose, because that's going to impact the liver. So I'd be looking at inflammatory markers. I do gut microbiome testing because the gut microbiome influence estrogen
Mm.
metabolism
Mm.
and blood sugar levels, etc., etc. So it's about pulling together the piece of the puzzle for that individual. It's never a blanket approach. So it's really beautiful when you take the time to do that investigative work that you can really piece together the puzzle for that individual in front of you and coming up with a plan to slowly tack away with what's going on. Do we need to give that liver a little bit more support? Do we need to adjust the gut microbiome? Do
Yeah.
we need to support the insulin resistance? Because they are all it's all connected. It's just not necessarily obvious to the layperson, but there's always that connection.
So when you look at the pathology tests and you're looking at liver function tests, for instance, are you looking at when you get your result back, the clinic will often put their range that they want those enzymes and things to be sitting within. Are you wanting it within those standard ranges, or do you actually have a more narrow
Yeah,
range that you want it to be sitting in?
yeah, with the liver function test, the range, we want it to be smack bang in the center if possible. That is the ideal. And then I'd also be looking if it's on the slightly higher side or on the slightly lower side, how could that mar up with other things that are going on in the body? So could it be an indication that we do have, for an example, any nutritional deficiency? So the enzymes that the liver function test is indicating need certain nutrients. And if it's really low, does that mean that we need to consider a zinc deficiency for that particular enzyme? So, yeah, it's about looking at everything together and going, oh, we maybe need to look down that pathway and see if that's an issue. So the liver function test tells us a lot more than just is there raised enzymes and inflammation in the liver.
Okay. Also, what I might go into now is a little bit around what sort of things do you tend to do to help support women naturally to manage some of their symptoms. Let's start off with the liver. You just mentioned there that sometimes they might need certain nutrients. So what sort of nutrients does the liver primarily rely on to be functioning properly?
Yeah, it needs all the B vitamins, amino acids. So we really need good protein levels and we need to be able to absorb our protein. So we've got those amino acids, which are the building blocks to the protein. Taurine is a beautiful nutrient for the liver, but we'd also be looking at some nice herbs as well. So
Okay.
it's depending on the person's symptoms that they're experiencing. Like I really dive into the stools. What do they look like?
We're back
And
to the
that,
stools.
yes, and that gives us an idea of are we producing enough bile from the liver? Does the gallbladder need a little bit of support at producing and releasing, or it doesn't produce the bile, it releases the bile. So we've got different herbs for all of those different things, but specifically for menopause, I love St. Mary's thistle, milk thistle.
Okay.
Really
And in
beautiful.
terms of interactions, is there something that people need to be particularly concerned about with milk thistle?
No, it doesn't upregulate phase two or change the phases of the liver. We've got phase one and phase two. So I think always, if you're on medications, double check with the prescribing practitioner. But generally, a milk thistle is very low in interactions with other medications. It's a very restorative herb it's hepatoprotective. So it protects and restores the cells of the liver.
Okay. And so you had mentioned at the beginning here that brain fog is probably one of the biggest things that women are suffering with. Obviously, the lack of sleep is a contributing factor. You said it, obviously that exacerbates things. What sort of nutrients or herbs and things are you using to help people with brain fog?
So yeah, absolutely. I want to get that sleep right because that's when we detoxify and we've got a lymphatic system called the glymphatic system that drains from the brain when we sleep and we need good quality sleep and which means getting enough REM, getting enough deep sleep as well as the length of time that we are asleep. Yeah, the herbs that I'd be thinking of, ginkgo, just such an incredible herb for many different things. And that is a really interesting herb because it's actually not has no traditional use. It's all science based on ginkgo. That's pretty incredible. I love that. Copa has a really nice calming effect on the brain as well. So if you're feeling stressed and overwhelmed, that's a beautiful herb. And gotchi cola would be a beautiful herb to use too because it also is incredible for skin, restoring integrity to the skin, which in menopause, because estrogen helps maintain the connective tissue and integrity, having that little bit of an extra boost for skin health is great too. Scotch cola has both of those benefits. So remembering that all herbs have more than one action.
Mm. And the ginkgo, is that more for daytime use?
No,
Okay.
it's not stimulating.
Okay.
Yeah, you would sleep fine on it.
What about something like CoQ10? Are you using much of that or ubiquinol for brain fog?
No, that's not generally my go-to for brain fog, but it would be a beautiful nutrient to include because of its importance for heart health. So Q10 is necessary for every cell, and because the heart has so many cells, so many mitochondria, because it's a muscle that never stops working.
Mm.
So it has a lot of mitochondria, which is an energy powerhouse of the cell. So yes, Q10 for energy, for the heart health, and yeah, absolutely. I think it gives brain energy because the
Yeah.
brain can become quite fatigued.
We will dive back into that because I think I want to talk a little bit more around how menopause seems to link to weight gain. But I'm just going to pop that aside for now. People often want something that's going to just help with their hot flushes. Are we having anything in the pharmacy that's actually working for these symptoms?
Yeah, supporting the estrogen progesterone. Yeah, definitely can be beneficial for women.
And what sort of like herbs and stuff are we looking at then that's going to help with balancing estrogen levels?
There's quite a few herbs that you could use, and I think I think the trick is also not to just go in and try and use herbs to adjust the estrogen and progesterone, because naturopathically we're looking at how everything is interconnected, and it is. Herbs that I would be looking at are Ziziphus, is great for hot flushes, and that's a Chinese herb. And then we've got sage. Sage grows amazing in my backyard. That's a beautiful herb that you could use, and it's in a lot of over-the-counter retail line menopause supplements. Shatavari is a beautiful herb, and that will help with supporting general production of progesterone and estrogen, but it also brings moisture to membranes. So nice for the urinary genital area for that dryness. Supporting adrenal health, Rhamania is a beautiful herb that is used traditionally in Chinese medicine and good for excessive sweats. But Rhamania supports the adrenal glands and the liver. Choosing herbs that have multiple actions and just seeing what's going on with that specific individual and what would be great for them. Hops, black cohosh. Yeah, there's lots of different herbs that we could be using.
And what about the safety profile then around black cohosh? Sort
Yeah,
of,
so
are we still limiting the amount of time maybe someone's on that?
I think with any drug or herb or food that people can have a reaction to, and black cohosh has had reports of liver. I think it's been more idiosyncratic reaction to the black cohosh, not quite knowing exactly why, but very often it's not just because that person is just on one thing. So the liver's probably overloaded and struggling with processing more than one herb or drug or what have you. But I think, yeah, definitely you would want to monitor your liver if you're on the black cohosh, but it's still very safe.
We've talked quite a bit there then about supplements and things that you can use to support. The other side of it is then using HRT or hormone replacement to help regulate periods and cycles. Interestingly, I heard the other day in another podcast that I did, there's fairly high rates of women having major surgery and things because of their periods being out of so heavy, I think is probably the biggest one, really heavy periods or painful periods. And they're getting things like hysterectomies and ablations and all that stuff instead of maybe looking at a hormone replacement option, which may actually help with regulating that. I think every woman is going to be different in the symptoms that they present with and how they can tolerate it. And so we've got options that you've just spoken about with the natural therapies and maybe those most certainly the nutrients and things, adding them in if somebody is on medication to do it together. And then there's obviously the more extreme cases as well. So from a pharmaceutical point of view, we are definitely seeing more HRT being prescribed now. There's actually been a real big influx. And I think a lot of that is coming back to identifying that there were some faults in the initial studies that were done, which put a lot of fear into doctors and women, understandably.
Yeah. Did you want to explain the Women's Health Initiative?
Yeah, I think the biggest thing is that initial study that was done was looking at women over 60 or women who had been sort of already gone through menopause and were long past it. And so it was introduced at a time of life when they would already have possibly increased cardiovascular risks. So it was really hard to identify from those initial studies whether it was from the HRT or not. They also used older medications to what we're using now, where we've got the options of the transdermal estrogen and we've got the micronized progesterones, which are similar to our bodies and seem to be better tolerated. The risks of stroke and cancers are lower. But we also know that if we were to do it within 10 years of having menopause, so the closer to the menopause date, the better really in terms of the benefit versus risk profile. If someone's stepping outside of that 10-year range from having their last period, then we are seeing higher risks of those. So that's probably it in a nutshell, really.
I think the major changes are the timing. Timing is important and the application.
So we would have more use of the transdermal now,
Yeah.
still associated with risks, however. So we do need to be mindful the risks are potentially still there. So that would really come back more to timing. Yeah, the transdermal does seem to be better tolerated. They may still, if they're in the early days, so if they have really early onset menopause, so less than 40, then they might do a low dose combined oral contraceptive pill to help give them the protective properties. If you go through menopause early, you might have a higher risk of osteoporosis because your estrogen levels have dropped off. That would be an oral form. Or we might do like the oral progesterone component and then a transdermal estrogen component. So they're combining the two. We also have then the Mirena, which is the inserted vaginally, and that's your progesterone only component. Or there's so many different forms now. We also have the Vagifem, which is the pessaries that is inserted for vaginal health. And that one, it seems to be a very low side effect or risk profile, even in older women. We find older women might use it, especially if they have recurrent urinary infections. It can be used. We can boost the doses there and help with comfort as well. So those are, yeah, there's lots of different forms. But you're right, the transdermal does seem to be better tolerated and used a lot more now.
Yeah. And I think there are some health experts in the field of menopause saying that it's safe, the HRT is safe for almost everyone. And I'm just showing caution to that. I think it's just too early to be saying that statement. I think we still really need to look at the individual, looking at the risks versus benefits. I just don't think we're that clear on it just yet. And I think it's incredible that we've got this new study. I think it's amazing that we've got the money being put towards women's health, but let's just wait and see a little, I think. And the reason why I'm saying that is because when a woman is healthy all over, they tend not to get the really heavy symptoms of menopause. They don't really struggle huge amounts with hot flushes. They don't struggle with so much brain fog. They don't have all of the urinary symptoms. It is a reflection of what's going on with you in general, in totality. Why is one person experiencing all of those symptoms and another not? It's more than just the hormones, because we do know that the hormones decline. That is a certain. But why is one person experiencing all of those symptoms and not another? So yes, we can come in and give the HRT, which is life-saving for some people. And I think it'd be incredible to be using it for heart health for some people, for bone health for others. But it's not the only thing that we need to be looking at. We need to be looking at the whole totality of that person.
You're right. But it also comes back to circumstance. And genetics is a factor. So women who have had trouble with periods and things like that at a younger age, they are likely to have harder time through menopause.
Absolutely.
But also someone might be going through something incredibly significant in their life and they just don't trying to work out which thing are you going to tackle. Sometimes it'll just, yeah. But I think you're right. We can't, when the pendulum swings so far in the other direction so quickly, you think, oh, we've got to question that. Let's just bring it back. Nothing can be all one way and all the other way. We've just got to bring it back and reassess. But I think what more so around that safety profile, really with the vaginal pessaries that are locally administered, the risk profile is a lot lower because it does tend to stay more localized, which is why they are happy for women who are older, they are past that 10-year mark, for them to use that for that particular purpose.
Yeah. And just swinging back to what you're saying about women that have issues with their period when they're younger. Yeah, absolutely. That's what I see. When someone comes to me in that perimenopause, I want to know what their periods were like before. And that gives me so much information around progesterone and estrogen. And often I will see estrogen dominance as an issue. So what that means is there's more estrogen compared to progesterone. So the ratios is what we need to be looking at. and just take a very thorough history of all their signs and symptoms, what their periods are like, getting really in detail around that can give us a clue. So very often women's progesterone needs to be supported in that perimenopausal stage, and of course before as well. Heavy periods is a very common side effect of having low progesterone compared to estrogen. And
And
how
so are you saying because they had high estrogen to progesterone previously that now that because there's a big drop now for perimenopause, they're noticing the symptoms more, or are they still through perimenopause still having a big ratio difference?
Yeah, I think the ratio difference is still there, and it just seems to give more side effects through that perimenopause, menopause. Yeah, they just tend to struggle more when you've already coming in having that imbalance in the hormones. Balancing the hormones when menstruating in your earlier years, heavy periods, PMS, the quality of the blood, is there clots, all of these things. The length of the cycle gives us huge amounts of information. When are you ovulating within the cycle? All of this gives us information about the hormonal balance.
I was just saying then about having HRT, particularly for early onset menopause, and now a little bit of a focus around trying to prevent osteoporosis. Obviously, we've got treatments for osteoporosis, but we want to prevent that, the brittle bones, the weakening, and the increased risk of fractures, especially if they have a fall, which is more of a concern when people are a bit older. There might be some protective properties coming from having estrogen as a replacement there. We can do bone density tests and assess where someone's at as well in terms of that. But again, a bone density test is really just telling us how far you've gone. We want to try and prevent it. So can you just have a little bit of a discussion now around your nutrients and things that we can use to strengthen bone health naturally?
The bones need many things to stay healthy, and vitamin D, calcium get a lot of attention, but there are so many other nutrients. And I think vitamin K is really imperative because vitamin K tells the calcium where to go. It is the director of the calcium. K2 is probably the most important for bone health. Magnesium, boron, really important for bone strength. Protein. The bones need protein, good levels of amino acids and collagen. Osteoporosis doesn't just start at menopause. It starts like throughout your whole life. Now, your blood will always want to stay the same pH. The margin of the pH of your blood doesn't shift much at all. And how it stays that same pH is through like calcium, magnesium, potassium, minerals that will keep the pH balance correct. And that takes it from the muscles. It takes it from the
A
bones.
bone.
Yeah. So if the so in a nutshell, what we need to do is making sure that we're not having a diet full of too much red meat, too much fizzy drinks, and we want lots of fruit and vegetables, nuts, seeds, and legumes, and all of these alkalizing foods so the body doesn't have to work as hard to keep the pH. And exercise. The amount of women that are not doing muscle strengthening exercise is incredible. You need to be moving your body and it has to be resistance. So the bone gets stronger through the muscles resisting.
Weight bearing
Weight
exercises,
bearing,
muscle strengthening, walks,
yes,
lifting weights,
yeah.
moving with weights in your hands. The two biggest things, my understanding is one, most certainly the exercise, the weight bearing, the muscle strengthening, Pilates, yoga, anything like that's actually helping you build some muscle strength. And yeah, that stress on the bones to keep them nice and hard. We had this big talk around making sure you're doing all of that when you're in your younger years, like teenage years, to keep really strong bones. And most certainly that is a part when you really build that strong framework to start with. But keeping that going through your whole life, and we do see that when women are older, it's hard to teleport yourself forward and think ahead Will I be able to carry my groceries in out of the car? Will I be able to pick myself up off the floor if I do trip and have a fall? Anything that's coming back to doing general movement around the house and functioning as a human, we need to start doing that exercise. If it's today, I'd say start today. There's always time for you to be building strength through your muscles and your bones. And then the other thing, most certainly, is around that protein, getting protein into the diet, because I see it all the time. The people that I'm talking with doing home medicine reviews, the percentage of those that don't get enough protein in the diet is really high. And obviously, as you're getting older, you're slowing down. Not everybody, but a lot of people are slowing down. They might not be doing as much work as they were doing before or running around like they were in their younger years. So they're not eating as much. And then because they're only having small meals, small snacks, they might have a little bit of toast in the morning, which really doesn't have protein in it. They might have a small salad at lunch, not really much protein in there either. So then when you're looking at your day, a lot of the older generation might get a little bit of their protein in their dinner, and that is usually about it.
Yeah.
And that's really not enough. But what I'm trying to, I suppose, tell them, oats, if you want to get any food, oats can be high in protein, legumes, Greek yogurt, eggs. Well, what else would you say? Nuts. What are
Yeah.
your favorite goes to?
Yeah, so your nuts, your seeds, your legumes, your beans, animal protein. I love supplementing with a protein powder, collagen. Collagen's amazing for the joints and the gut and the bones, skin health. That's a really easy thing to add into cups of teas or what have you. So, yeah, just not filling up on too many grains and bickies, and it's what you remove as well, because if
Yeah.
you are filling up on the wrong things, then you are not going to have enough room for all the protein. As many vegetables as you can fit in is imperative, but also, yeah, the quality of the protein is important too. Looking at all the different food groups, not just a handful.
We also know that women will tend to put on a little bit more weight through menopause commonly. And I only recently discovered that's because our weight, particularly around our middle area, it's the body's way of trying to increase estrogen by putting a little bit on there, but it's not the estrogen that we want and that we need, but it is why it tends to be there. And I suppose that's probably why a lot of women do try and diet. And that's where that comes in the dieting by trying to eat small meals and eating salads and veggies and things. Veggies are great, salads are great, but you do need to still be getting those good quality nutrients in there to help with that weight management. Is there anything else that you would recommend that they could do around, that
Yeah.
weight gain?
So what happens is when estrogen declines, that it impacts the insulin sensitivity. That insulin sensitivity impacts the liver health, it impacts where the fat deposits. So it deposits around the abdomen, as you mentioned. And yes, so good amounts of protein, not putting the body through stress. Stress will further dysregulate the insulin and the blood sugar levels, and it impacts the adrenal glands as well, because the adrenal glands do produce hormones as well, estrogen and progesterone from the adrenal glands once the ovaries stop. So we want to decrease the stress, we want to increase the muscle mass. The good quality muscle will impact the way that you metabolize, impact insulin resistance. Making sure you've got enough protein in the diet, make sure you've got enough fiber, good quality fat, omega-3s from fish and olive oil, because that impacts your insulin and your blood sugars. Yeah, it just all comes down to just these healthy lifestyle habits, and the sooner you can implement them when we're going into menopause, the sooner you can get a wedge in and stop that insulin resistance cascading, you're going to have much better health outcomes for heart, for liver.
The rate of diabetes is huge. It's really quite sad. And I think I get a feeling that people don't realize the significance of it. When they are diagnosed initially, the teeter on the borderline of having too high blood sugar levels, we have different ranges for different times of life. So we do try to stick within certain ranges, and it really depends on the person's circumstance. But I think when they initially get diagnosed with diabetes, I just feel if people knew where that was going to head, if they don't nip it in the bud and get their lifestyle sorted quick smart, get that protein into your diet to help regulate with the carbohydrates. If you're having protein in with your sugars, when you're eating something that has a bit of sugar, it's going to slow that release down. It's actually going to help you manage your blood sugar levels so much better. If you don't do that in that early stage, what I see down the track is people are on 3, 4 different medications trying to regulate their sugar levels. They've now got injectables, they've got orals, they're moving towards insulins. Then we see their kidney starting to fail. The kidney function is no longer functioning the way that it did. Now we have another issue because your kidneys aren't functioning. We can't actually use the maximum doses of the diabetes medications that we used to do. Metformin, the most common medication that people would start on. Okay, now we have to reduce that dose because your kidneys cannot handle it. So the doses are dropping back and our sugar levels are still rising and our kidneys are failing. And then huge amounts of people lately are having, the ones that I'm seeing, the peripheral neuropathy. They're not feeling their feet. They're getting tingling in their legs and their feet. It just cascades. What I see towards the end, I just wish that when people initially saw that their blood sugar levels were getting a little bit out of control, they took that point really seriously and got it sorted.
Yes.
And really, it's that lifestyle. It's getting the movement happening and getting the diet sorted because
And it
it's
is,
not a good future.
yeah, and it is really preventable. Type 2 diabetes is preventable. And I really wish that GPs are testing for fasting sugar and fasting insulin with any person that's going in there for a blood checkup, really, because it's such a huge cost on the healthcare system and it's a huge cost on your own well-being, your own lifestyle.
Yeah. And I suppose women just knowing that as you're approaching that age of perimenopause, that your blood sugar levels are likely going to start raising around that
Absolutely.
time.
Yeah.
So being aware that's going to happen,
Yeah.
be proactive of it.
Yeah. Yeah. Unfortunately, we have to just work that a little bit harder than we
Mm.
did before with our diet, our lifestyle.
Let's talk about vaginal dryness and discomfort, and we'll probably tie that a little bit into libido because I know we've gone through quite a bit. So we'll try and be a little bit quicker with this part. So yeah, as your estrogen helps keep the vagina nice and moist. By having that moisture there, that's what keeps us feeling more comfortable as we're getting dry, as the rest of your body. If your hands and skin is dry, you get itchy and uncomfortable. It's exactly the same thing with the vagina. If that is dry, it's going to be uncomfortable. And what I do commonly see in the pharmacy are women coming in asking for antifungal cream because their understanding is if I've got an itch and a discomfort, it's probably going to be candida, a fungal infection. And that's actually not the case. And I think even when they have used it and they found they got relief, it's not necessarily because they treated a fungal infection. It's probably more so because they put moisture into the vagina through the cream. So I think trying to get that message out there of what are your options to help improve moisture. And from a pharmaceutical point of view, that's where we would see more of the Vagifem maybe coming in, which is that estrogen pessary that I spoke about before to help put moisture in. Some women might use something like Replens, which is an over-the-counter moisturizer, vaginal lubricant. What would you tend to recommend to people that might help with getting a bit of moisture without having to go down the HRT route?
Yeah. So if we're just talking moisture in particular, coconut oil can be beautiful. So it has a slightly antifungal effect as well, but primarily it's just a really nice oil to use for the moisture. but naturopathically, nutrients and herbs, we'd be looking at supporting the hormones. And we haven't spoken about phytoestrogens yet. So phytoestrogens are little compounds in food that sit on estrogen receptors. And so they act as little modulators, really. They help with someone that has estrogen dominance, and they also help with someone that's got low estrogen because they're sitting on the receptor. They're not acting as estrogen. They don't convert into estrogen or anything like that. They share the same receptor site. That could be soy, always going for an organic soy or fermented soy is a nice phytoestrogen. Flax seeds, linseeds are one of my favorite, and because they can be so beautiful for the bowels as well. Beautiful fiber, help the bowels stay healthy. So that would be my top tips. But yeah, Vagifem, as you mentioned, can be really beneficial for that dry vagina. But we've also got prolapses that occur because estrogen is really important for connective tissue. Connective tissue is literally what holds everything together. So that we start to see decline, saggingness of everything in our body. Physio can be really beneficial, getting a proper assessment of what's going on there. As you mentioned, people are maybe self-diagnosing with some sort of infection when it's not that, or maybe it could be a prolapse that's causing pain or something. Yeah, don't put up with the symptoms. Get a proper diagnosis, get the support you need, so then you can take the action, the appropriate action.
I was going to talk a bit about low libido. There is some movement to using testosterone now to help with libido. I think that would need to really go through somebody who knows what they're doing if you're going to go down that route. So a specialist or a doctor that does tend to do a lot of work in that area. By increasing your testosterone levels, you can also improve libido that way. What if someone didn't want to go down using testosterone, because you do need to keep using it for it to be effective? What can we do can we boost our testosterone naturally?
Yes, this is a beautiful herb for that.
And women can use tribulus.
Yes, absolutely. There's no
Wow,
herb
okay.
that is male or female. So
And what would like potential side effects though of that be? Because I do see obviously more commonly with men who want to bulk up and
I don't think there's any notable
okay,
negative side effects or anything like that. No.
okay.
Remembering herbs are very gentle. It's not, drugs are a lot more aggressive. Herbs have many actions and they tend to be very well supportive. So it can also support the adrenal glands as well. So yeah, tribulus can be great for stress. So I would be asking the patient what's going on. What is it because the sex is painful? Is it because of the dryness issue? Is it because you're just not interested anymore? So figuring out what's going on to give the appropriate advice. But I think we don't often talk about estrogen, progesterone, testosterone, how they are affecting our psyche. Like they're there to make us want to copulate and have sex and reproduce, right? And when they decline, that desire simply is not going to be there as much. So we are certainly moving into a different phase of our life where, as a mother, those hormones are there to be quite nurturing and mothering. And so we're moving out of that phase. And it's really, I see a lot of women start to go, okay, now it's finally about me. And so, yeah, I think taking the time to go within and really see what are your desires now? How have things shifted for you? And just not keep pushing through. Yeah, I think there needs to be a negotiation with your partner. What does it look like for you? And what do you need now? Because it might be both for, there might be change for both men and women because as men's testosterone declines, menopause, then that's going to change their desires too. So in just taking things slower, doing different things to get pleasure, yeah, it's just not going to look the same as what it used to. And I think we need to be just really having open conversations with our partners about that. We've just got such busy lifestyles too. When the hormones decline, the reproductive sexual hormones decline, then I think the stress almost overcompensates that desire. It requires a whole lot more effort. That's just the way it is. I really don't think it's just about replacing hormones. I think that it is how are you as a whole will be impacting it.
Wonderful. We've covered so much stuff. I recently discovered the AMS symptom score. People can simply Google AMS symptom score, and it is a survey that you can fill in, and it will give you some kind of score around, your symptoms that might be associated with perimenopause. So that's something people can do in their own time at home. I suppose it would be a good thing for women just to make a note of stuff that's going on in your life if you're approaching that age of potentially menopause, and what are bothering you the most. And then, I think taking a beat to what way do you want to go with this? Because you can head in a lot of different directions to help manage your symptoms. How bothered are you by it? Are you able to just tough it out, get through it? Do you want to tough it out, get through it? Or do you need more assistance? And so there's lots of different ways to go with this.
And I think I think we've been led to believe that that is what we may need to do, is just get through menopause. But we know that there are so many different comorbidities. So it's not just about those overt symptoms, such as hot flushes and mood changes and dry vaginas. It's the heart health, the brain health, and the bone health. I think to empower women to go, now is the time to be really looking after my health, because I want to live a vibrant future where I am active and I can enjoy life, and I'm not stuck in a bed because I've got osteoporosis or I've got hip fractures. So take it really seriously, and just know that there are many things that you can do, many options now. And I think most of all, even if you choose to go down the route of HRT, hormone replacement therapy, then you need to look at the whole body. HRT is not going to is not like a wonder drug. It is very supportive, but we still need to be doing all of the other things that keep us healthy.
Yeah, you can't have HRT and eat a terrible diet and not do any exercise. Like, it still comes back to the fundamentals.
Exactly.
Yeah.
And that's where naturopathic care can really come in, because we look at the diet, we look at the lifestyle, we'll look at all the pathology. And if you are on HRT, we take that into consideration. Supporting the liver, looking at the gut microbiome, how is that influencing your estrogen, progesterone, etc., etc.
Yeah. Go do that health assessment, that midlife health assessment, get a thorough check, all your pathology run, and then see where you're at. Thank you so much for your time, Tracy. I've learned lots from you as per usual. If anybody does want to know a little bit more about one of these particular sections, most certainly reach out to Tracy or myself through Instagram or website. We'll put all that into the show notes so people can find us.
Anyone can book a free assessment with me, and we just go over what's going on for them and to see whether we're a good fit to work together, and we go from there.
Beautiful. Fantastic.
Thanks, Alex.